Hello and welcome to the Becoming Mama podcast, where two long-lost best friends discuss all things motherhood. I'm your host, Emmy, and I'm here with my co-host, Sam, and I am also here with our wonderful, brilliant, amazing guest, Anna Peterson. She is going to be sharing some information with us today about the placenta and about any other midwifery, doula, birthy world type questions that come up for her while she's here with us. Anna, would you be willing to share a little bit about yourself as we welcome you to the podcast here? Are you comfortable doing that?
Yeah, sure. So I am lots of things to lots of different people. I am actually a professor of history at Luther College in Decorah. So I live in Decorah, Iowa, pretty close to Emmy.
Yeah.
In addition to that, am a doula, a childbirth educator. I've been a midwife's assistant for about 4 years before this past year have stepped into the role of training to be a midwife, primarily for out-of-hospital births. So most people who are giving birth at home, but also birth centers. And in all of that work, I have done placenta encapsulation. And so I'm passionate about placentas and all the things that they can possibly do for supporting mamas postpartum, because we all know that moms need support postpartum. And so this is one of the supports that are available.
Yes.
Yeah.
Thank you for that wonderful introduction. It was beautiful, and all things are true. So the reason I invited Anna to come onto the podcast today was because I recently told Evie's birth story, which was our free birth home birth that we had 2 years ago in December. And as part of that birth, I realized the birth story that I shared, I forgot to talk about the placenta, which was something that was really, really important to me in that birth story, because with Fox's birth, I didn't have the opportunity to see his placenta at all, and I felt very robbed and wounded by that experience for a really long time. With Twyla's birth, I gave birth to my placenta. I had it here. I put it in the freezer, and guess what? It's still there.
You can still do something with it.
I still want to do something with it, but I am not sure what I want to do with it, and I really want to honor it, and I have lots of ideas, but I'm just sort of like stuck there with it. And so for Evie, I really wanted to do something special, and I wanted to kind of do it right away so that I wouldn't have the opportunity to stall again. And right at that time, Anna had recently become kind of recently, right at that time, 2 years ago, had started encapsulating placentas. That was kind of a new offer that she had. And so her being my local and wonderful friend, I sent her a message on Facebook and said, hey, I would love it if you did that for me. So she did encapsulate my placenta that was from Evie's pregnancy. And she also created some really beautiful art prints. She came to our home the day Evie was born. We were able to just we left the cord attached to Evie for a really, I don't know, somewhere between 5 and 7 hours. And then Anna came over and we did kind of like a little cord burning ceremony where we detached Evie from her placenta and really honored that journey. And it was so beautiful. Zach and my sister really took the lead on that. And I think you helped a little bit, Anna, didn't you?
I think so. Yeah. I think I helped with some of the logistics.
Yeah. Yep. And then, Anna, who also brought like treats and goodies and all these beautiful things, she kind of whisked the placenta away, and then not too long after she brought it back. I think it was a few days it took to dehydrate it and all of those things. So that was just a very special experience for me, and I want the whole world to know about it, because I think that lots of people don't know that we have options for these types of things.
Yeah, and I'm not supposed to be the one asking questions, but I'm curious, Emmy, since you did have 2 births without doing anything with the placenta, if you felt like postpartum was different than with Evie having had those placenta pills available.
Yeah, so one thing we'll maybe get into a little bit is the benefits of having your placenta encapsulated, or also the benefits, and I don't know if you'll be able to share some about this, Anna, but taking the raw placenta, cutting it up, freezing it, and being able to ingest that after. My sister also did like the placenta smoothie, so there's lots and lots of different options. But for me, went with the encapsulation, so that means that Anna dried the placenta in a very sterile, clean way, and then put it into a powder form, which was then put into little capsules, which she then brought over to our house. And I didn't really feel called to take it right away, the capsules, so I didn't. I very much just listened to my body. And then anytime I felt like those baby blues starting to creep up on me, or I felt like my hormones were just like really raging or really low, anytime things felt like a little bit out of whack and I wasn't sure why, I would take those. I'd take a few of them a day for a couple days, and it always helped. Like I don't know if it was placebo. I don't know if it was the placenta. But I'm a firm believer at this point. I would 100% do it again, and I found it to be very, very helpful.
Oh, that's great. I'm glad we never really, I mean, I knew that you had a good experience, but we haven't talked too much about it. So it's fun to
Yeah,
hear.
no, we haven't. So, yeah, it was really helpful and really great, and I would 100% do it again.
I even as someone who's given birth, I never saw my placenta. I don't even know if I was asked. I don't have any memory of it at all. And I still don't have a great understanding of what the placenta is, what it does, what role it plays in gestation and afterbirth and all of that. So could you give just like a brief summary of like what is the placenta? What's the process after it has left your body and all of that?
Yeah. So the placenta is really cool because it's the only organ that your body makes and then discards. So that's called like a transient organ. So it's something that both you and the baby like co-create, and it's really like a transportation system. So it's like the delivery of oxygen and nutrients to the baby, and then the taking back of waste products, right? So that your body, the mother's body, is giving the baby oxygen and nutrients through the placenta, and the fetus or the baby is then exchanging that with waste products that are going back to the mother, who can then discard them. And then it also plays a really important role with hormone regulation as well. And so really the placenta is what is feeding and growing your baby. And it is what is allowing that to happen. If the placenta is healthy and functioning well, there are like certain disorders that can happen that can just cause some problems with the placenta. So preeclampsia, maybe you've heard of that,
Yep.
is one of the things that can arise in pregnancy that just means the placenta isn't working very well and can cause a lot of problems, particularly for the mother, who could then end up with seizures. That would be eclampsia. Or there could be other placenta insufficiencies, and usually that results in the baby just not growing very well. So intrauterine growth restriction would be one of the kind of warning signs the placenta isn't working very well. The placenta is really cool in the fact that it does all of those things, and then it works generally really well, like all the way through even post dates. So going to 42, maybe even 43 weeks. But we do start to see like on the placenta that the longer the placenta is functioning and working for you and the baby, the harder it is on that placenta, right? That it does kind of have, a time sensitivity to it. And so like a baby that's born, let's say at 42 weeks gestation, the placenta might have more calcifications in it, or just little spots that aren't working as well. It might be a little bit more just friable and easy to kind of come apart. But in general, like placentas are great and they do everything that they're supposed to do in almost all cases, kind of helping the baby to grow and develop. And so what happens is the placenta is kind of in between the uterus and attached to the endometrium on the mother's side. And that side, if you look at the placenta after it's outside of your body, is kind of bumpy and has lots of like crevices in it. It's called Dirty Duncan, which is not a very nice term. That's right, that goes against the mother. And the other side that the baby sees is called Shiny Schultz. And that's really beautiful. And it has what a lot of people call like the tree of life because of the many different vessels that are in that part. And that's where the umbilical cord inserts, is to that side of the fetal side of the placenta. And it is kind of shiny and silvery looking on that side that the kind of baby is looking at. I think it's less common in the hospital for them to show you your placenta, that you really have to ask for it. And it's almost thought of as like, I mean, it's afterbirth, right? That's another name for the placenta.
Yeah.
And I think it's kind of like an afterthought. Like, okay, the main focus is on the baby. The baby's here. We're not really thinking about the placenta. It's just something to be discarded in the hospital. But all the out-of-hospital births that I've been to, it's always an offering to look at the placenta, to kind of have a little bit of a tour of it. Sometimes there's some really cool things like with the cord, like a true knot. One of my babies had an actual knot in the cord, but you can just move it like up and down because of the cool like gel that the umbilical cord has as a part of it. Sometimes the cord will be inserted off to the side of the placenta. Most of the time it's in the middle of the placenta, which is where we would expect it to be. We also can see the sac that the baby was in. And so what's really cool is you put like the cord in there and you can lift up, the placenta would be hanging here like at the bottom, and then you're holding it up by the sac and you can see like, oh, that's where my baby fit and lived for like 10 months or so.
So cool. Yeah. What's crazy is I've seen my sister-in-laws, like it wasn't until like long after when I was talking to Emmy, I was like, I never saw mine. And I don't even remember being offered. And you're in such a daze at that point. You know, you got the rush of hormones, holding baby on your chest. Like really the last thing on my mind was to ask for anything but to be with him, but I still wish I would have seen it. So it is really interesting to hear. And there's a ton of great information. I think that gives a really great primer. Real quick, last thing I wanted to ask about this was the positioning of the placenta, because there can be different, like there's anterior, posterior, and then is it placenta previa where it's, I guess below are those different decisions, right?
Yeah. And placenta previa would be where it would be covering basically the opening to the vaginal canal and the cervix. Okay. And so generally those who have like true placenta previa, we're thinking about a cesarean birth because there's just no way for baby to come out of the cervix. But it's very rare for placenta previa. And even if, like, let's say early in your pregnancy, you have an ultrasound and they're like, oh, you have a low-lying placenta, or you have a partial placenta previa or a complete placenta previa, that by the time baby's ready to be born, the uterus will have grown and stretched and that the placenta kind of moves up with it. And so it's rare that by the like 40 weeks, that placenta would still be placenta previa or a low-lying placenta. But yeah, you're right. Like there's anterior placenta. So there we're thinking like the front of the body, right? We're thinking about posterior placenta would be toward the back of the mother's body. If you have an anterior placenta, one thing that's interesting with that is that it just makes it harder to hear baby. Like if you're using a Doppler or a fetoscope, because that placenta is kind of blocking the baby, right? And so you hear a lot of placenta, which I don't know. Have you ever heard your placenta before, Sam? Emmy, have you heard yours?
No.
Yeah. So it's like a whooshing sound. It's like that. Where baby's heartbeat is more like a galloping kind of sound, and then your heartbeat is like a steady beat. So if that placenta is in the front and kind of blocking, you're just going to hear a lot of that whooshing sound, and it's harder to hear baby's heartbeat. But there's nothing wrong with it being in that position at all. Sometimes the spot where a placenta is, like if it's often like in the right upper quadrant of the body, might explain like if a baby were to be breech. Sometimes there's just less room for baby, and so baby takes that kind of a position. So the placenta can affect, other parts of your care. But most of the time, I'd say it's really not thought too much about. Because it does what it should and it is where it should be, and everything works just the way you would hope it to.
That's awesome. Thank you. Thank you so much for that. It was a really great primer. Now I'm so excited to hear about some of the things Emmy was saying, like the different options for placenta and the benefits of that. Can you go into some of your questions that you had based on your experience?
Yeah, I love that you backed things up because I'm always like, I'm like a racehorse, like, let's get to the information. I've got so much.
You just know so much. Yeah, you just know so much already that I don't. So we complement each other in that area.
So maybe before we go into the actual benefits, we can talk a little bit about the birth of the placenta. If there's anything you'd want to share about that, Anna, then kind of like when you are at a um, out of hospital birth or in hospital birth where everything has sort of gone smoothly and there is a plan to do something with the placenta, what's the normal thing that you see in terms of like babies born and then what?
Yeah. So baby's born, and it kind of depends on where you're at and what the protocol is. So most of the time in the hospital, they're giving Pitocin with the birth of the baby's head. And that's to manage postpartum bleeding, but it's also to facilitate the delivery of the placenta, because the longer the placenta stays inside after the baby's born, the greater the risk you have of extra bleeding. And so in the hospital, they're trying to manage that. And so they're giving Pitocin, and they're hoping that the placenta is going to be born within 10 minutes of the baby being born. And if the placenta is not being born within 10 minutes, they're going to be doing some extra interventions, possibly like a fundal massage, so rubbing really deeply, like where your womb is, giving some extra Pitocin, maybe pulling on the cord or offering some cord traction to get the placenta to come. If you're working with people who are not actively managing the placenta and are waiting for the placenta to be delivered on its own, so more of a physiological birth of the placenta, it can take anywhere up to usually an hour after the baby's born for the placenta to be born without any kind of interventions. But I would say in my experience, most placentas are born within the first half an hour. And sometimes placentas, like, they'll call it like a little bit of a sticky placenta, or it just like doesn't want to come all the way. And there's different herbs that you can offer. Angelica is probably the herb that's most frequently used for helping the placenta to release from the body and come. There's different positions you can be in to help the placenta come. So sometimes squatting, more upright positions, which of course you've just had a baby, so not everybody wants to get up and like get into a squat. But that can help. Some people want to go sit on the toilet, but that just helps to like let the body relax and release. And so after the baby's born, there's all these hormones that are going to trigger the placenta to release from the body. And again, we want it to release really up to an hour, within an hour of the baby being born, just to prevent any extra bleeding from occurring. And what's going to happen is it's very similar to pushing the baby out, except of course there's no bones. And so it's a lot easier to release the placenta from the body. And so often like you get into a nice position, like let's say a semi-squat or hands and knees, and you're going to offer a little bit of a push when you have a contraction, because you'll have still contractions after the baby's born, as long as the placenta's still in. And with a contraction, offer a little bit of a push, and usually the placenta will come very easily then just out of the body and still be attached to baby through the umbilical cord if that hasn't been cut. And so you can put it like in a bowl and just have it next to you. You can then cut the cord. Some people want to cut it as soon as the placenta has been born because they feel like there's less benefits to having it still attached. Does that help explain a little bit, Emmy?
Yeah, definitely. My experience for Twyla and Evie's birth was definitely that after they had been born for a while, so I think Twyla had been born for like 30 minutes to an hour when I felt like, oh, like I feel like I need to push something out now. And then I just sort of sat up on the squatty potty and it just came out. And then with Evie, it was a very similar experience of, I think it was actually pretty quick, maybe 15 to 30 minutes, where I just kind of was laying down in the bathtub, sat up a little bit and pushed the placenta out. But it was really special to have the placenta there, able to talk about it. Fox and Twyla, I think they each had like a little pencil and they were like poking at it and exploring it. And like you said, lifting it up and seeing the inside and kind of, making that connection of, oh, this is where my sister lived while she lived inside mommy's body. So really special and really cool to have that opportunity for them and for us as a family. I love to see too how placentas all look different, how their size can be so different, and their coloring, the cord, like everything about them is so fascinating if you've seen a few of them in your journey and you're like, oh man, they're just really neat to look at.
Yeah, and there's different kinds of placentas, again, more rare. But I actually was at a birth a few months ago now where they had a centuriate placenta. So that means like there's two separate lobes. And so the placenta was born and there wasn't any extra bleeding. Usually with that, you would typically see some more bleeding because, again, something is still being retained in the body because this extra lobe was still inside, even though the other placenta had been born. And so after a while, it was like, oh, there's, something there. And we looked and, yep, there was another lobe of the placenta, which was super cool. I've never seen one before that. So that's the only time that I've ever seen that happen. But there's some cool, like, variations.
Yeah, so many fascinating things. Do you have any book recommendations while we're right at this topic? About, I know that there's a few and they're just not well known or widely circulated at all. Maybe that's something I can drop in the comments because I know my sister has quite a few recommendations in that department.
Great.
All right, so let's dive into the benefits then. If maybe someone gives birth to their placenta and then decides that they want to take the route of either encapsulating it or freezing the different sections of it or putting it into a smoothie, what are some of the benefits they might experience from taking advantage of that opportunity?
Yeah, so I'll say, as an academic, like I'm really interested in scientific studies. And there just are not that many scientific studies that have been done on ingesting the placenta. We know that the placenta has been ingested like in certain traditional communities, particularly in China, for hundreds of years. It's come to the West much more recently. And surprisingly, there are some older studies that were actually done like in the 1920s. So people were definitely doing this in the United States earlier in the 20th century. But it's become much more popular, like within the last 25 years. I think now about a third of all community births or home births, people are interested in having placenta encapsulation done. So that's a pretty significant number. And most of the time, if you ask those women, like, why are you having your placenta encapsulated? The reason that they're going to give is that they're hoping to avoid postpartum depression. And so there's not a lot of studies done on whether or not placenta, like ingesting the placenta can prevent postpartum depression. But there's some kind of intriguing other things that have been found. And anecdotally, women report all sorts of benefits for the placenta. So including postnatal mood stability, having more energy, increased milk production, reduced bleeding, and also just having a faster recovery after baby. So some pretty significant benefits is what women report. Now, when they've done these studies, they've found prior to like the 2010s, there were a couple of studies, and those are mostly interested in milk production. And those studies did find that ingesting the placenta led to increased milk production and faster weight gain in breastfed infants. So it's pretty interesting. But that was like 1920s, 1950s. And then there were like no studies of placenta ingestion until like the 2010s. And then they were more so looking at like what kind of minerals and what kinds of hormones are left in the placenta, particularly after encapsulation. So they found that there's iron and selenium, that those are the main minerals that remain in the placenta after dehydration and encapsulation. And then quite a few hormones, so including oxytocin, estrogens, progesterone, human placental lactogen, ACTH, and CRH. So those are some of the hormones that remain after dehydration. And encapsulation, and those things are linked to improved mood, right? But so the studies have found like, okay, these things are still retained in the placenta, but they haven't made that kind of link to like that means that there's a decrease of postpartum depression. But we know that those same hormones are often used in treating postpartum depression. So it makes sense that ingesting the placenta can aid in the reduction of things like postpartum depression, which is why most people are doing it in the first place. So that's probably one of the biggest benefits is the mood stability. But also, like I said, increased energy, milk production. I always tell people when I give them their pills, like some people have a lot of energy after taking them, so don't take them at night. And that is probably one of the things that I've heard the most of from people is like that they do get a boost of energy from taking it. And so just being careful about the timing of when you're taking it can be important. Yeah. And so there are a lot of anecdotal benefit. There are a lot of anecdotal benefits to ingesting placenta. But I will say that it partially depends on how you do it. So, I mean, you kind of mentioned earlier, like there are different ways of ingesting your placenta. Like it can range from, having it raw, and there's some different forms for doing it raw, right? Like making it into a smoothie and taking like a shot of it every day. You can cut the placenta really into small bite-sized cubes and freeze it like that. And then just like pop it in your mouth and down it with a glass of water like a pill. So the closer it is to the raw form, the more of those minerals and hormones that the placenta will retain. So the more benefits you're going to have. The next method is the dehydration method, where you're dehydrating it at a low temperature for a long period of time. So I dehydrate mine at like 160 degrees for about 24 hours. And then you're pulverizing it and then putting it into the capsules. Another method is the traditional Chinese method. And that's kind of the most preparation. So what you're doing with the traditional Chinese method is you're first steaming it with different herbs. And then after steaming, then you're dehydrating it, then you're pulverizing it and encapsulating it. And with the traditional Chinese method, you're going to have the least amount of hormones and minerals preserved because you're just adding in that step of first steaming it. So the more preparation you do to the placenta, the fewer benefits potentially that you're left with. But also the more preparation you do, you're mitigating some of the potential risks that there might be, like if there's any toxins in the placenta. And so some people want to make sure that they're at least dehydrating it, so that there's some kind of removal of the toxins that might be in the placenta. So there's very low risk, but the American Academy of Obstetricians and Gynecologists do not recommend ingesting your placenta in any form. And one of the reasons for that is a few years ago, there was a baby who developed a case of group B strep after the baby's mom had been taking placenta pills containing group B strep and then breastfed this baby, who then picked up the group B strep through the breast milk, and she got it from the placenta pills. So there are some contraindications for having your placenta encapsulated or ingesting it in any form that are kind of important to pay attention to. And again, some people want just more preparation because they feel like it mitigates some of the risk that, comes with maybe ingesting it raw.
I think that makes sense. I think that's such interesting and valuable information. And one thing I think we should mention is that I like how you mentioned that there were those studies that were sort of done in like the 2010s. Does that kind of align with when one of the Kardashians made it very public that she was doing something with her placenta, and then it became very popularized in our culture, and there was a huge shift of, we don't do anything, know anything about placentas, and all of a sudden it's like everybody's kind of thinking about it and has it on their mind and has a plan for what they're going to do, whether that's nothing or something.
Yeah, I think that's one of the factors that led to the increased kind of interest in it. I think another factor is just the increased awareness surrounding postpartum depression and anxiety disorders or perinatal mood disorders. We know, right, that has just continued to increase, particularly even after COVID, right? So I think there's an awareness about perinatal mood disorders that made people interested in like, well, what are some treatments or what are some resources out there to help mitigate some of those things. And I think also there has been a significant increase of home births over the last 10 years. It's at an all-time high, at least, of course, everybody used to give birth at home. But it's at an all-time high since we kind of saw that shift from home to hospital. And since they started keeping statistics on it. And so I think also like, if you have a home birth, you're more likely to ingest your placenta as well. And so those two things I think go together too.
Something I was thinking as you were explaining the benefits. So my specialty is in matrescence and in that transition into motherhood. And one of the things that we talk a lot about in that realm is the control aspect. Like you feel really out of control and can feel like your body is not your own. You can't, like, there's not a whole lot you can do about what's happening internally, but this is something that is seemingly low risk, even if it helps on a placebo level of this is something I can do, that I can choose to do, that I can take the power of and potentially help me feel better. I feel like that alone would be so powerful. And as someone who dealt with some pretty extreme emotions in the postpartum period, I can definitely see how even thinking that, like that power of the mind of thinking this could really help me, that would be a wonderful tool to have. So yeah, it's really fascinating.
Yeah, and I'd say like that is like most of the recent studies that have been done on this always end with like, more needs to be known. But the fact is it's very low risk. Like, what can it hurt? And the potential benefits, even if it's just placebo, like you said, are significant. And so the kind of benefits significantly outweigh the risks. Although it's interesting that now the American Academy of Obstetricians and Gynecologists have come out kind of against it. And I do wonder, like, to what extent that will affect people's ability to be able to take their placentas home if they give birth in the hospital.
And you know what? That unfortunately doesn't surprise me, because most prenatal and postpartum recommendations, breastfeeding recommendations, are there's no safe amount, quantity, anything. So we can't give you any type of, this happened this one time. Eating in labor, another great example. Somebody asphyxiated this one time, so we're not going to even let you do this at all, when that should be up to us to make that educated decision.
Right. Yeah. And so it is just that one instance that we know of where a baby did become ill.
Wow.
But yeah, like you're saying, there's kind of a pattern of that just takes place, and not letting people decide for themselves what their risk comfort is, or not letting people know that they get to decide what their risk comfort is. Because I think that things are just often presented in such a way that you don't realize that you have choices when you do.
Yeah, well said.
I think my last question as we kind of wrap things up here, Anna, this has been such a magical conversation, and I've been so happy to connect with you again and hear you share all of this. But I wondered if you have any information or experience on some of the things a person could choose to do with their placenta if they don't want to ingest it, but they do want to honor it in some way. So I have my experiences I could share, and I touched on it a little bit earlier, but do you have any examples that you've come across in your work of things people might choose if they don't feel like they need the actual ingestible benefits? I don't think that's a term. Ingestible benefits. But wants to do something, they feel called to honor their placenta in some way.
Yeah. So there's lots of things that you can do with your placenta. that range from, like maybe eating it raw to throwing it in the garbage. And it doesn't have to be either one of those. There's lots of things kind of in between. One thing that I've never seen anyone do, but I know some people do, is a lotus birth, where you keep baby attached to the placenta. You don't cut the umbilical cord at all until the cord just naturally dries and falls off. And so keeping baby attached to the placenta and that kind of period of time of kind of honoring that relationship between the baby and the placenta is one option with a lotus birth, it's called.
And that is actually a book. We mentioned books earlier. You can look up the book Lotus Birth and learn all about that technique.
Yep. And then I think, first of all, like seeing your placenta and kind of getting to be a part of the placenta exam can also, for many people, feel like a way to honor the placenta and to honor that part of the birth. And that doesn't, necessitate you needing to touch it or do anything like that, but your provider can kind of walk you through, or you can walk yourself through. Even just like there's tons of YouTube videos out there that talk you through kind of the different parts of the placenta. And so being able to see it and like understand it, I think can be important for a lot of people. And then some people want prints, like Emmy, you wanted some prints. So you can print it. You can use just the blood, right, that the placenta kind of has still on it from the birth. Or you can also like use different dyes. Of course, you want especially if you're encapsulating it afterwards, you want things that are food safe. So be thinking about that. But turning it into some kind of artwork is another thing that some people want to do. I'd say a pretty popular option is burying your placenta and planting something like a tree, often, or maybe like a rose bush or something like that, to kind of not only honor the placenta, but also like mark the birth of that child, and then watching that plant grow over time, just like you watch your child grow over time, and that placenta is like nourishing it like fertilizer. So that's a pretty popular option, I would say, and maybe something I'd recommend to you, Emmy, with the one that you still have in your freezer.
Yes, I think like that is the plan. I'm always like, Zach, this is gonna be the year. This is gonna be the spring that we plant the placenta and I make closure with Twyla's birth. And he's like, okay. I'm sure it is.
Yeah.
And then we have something from our deep freezer 7 months later, and he's like, still see that placenta in there. He really wishes it could move on, but apparently I'm not ready. At some point I'm guessing I will feel called. And I think probably if I dig a little bit deeper into that, I worry that this won't be our forever home. And the idea of leaving some of these things behind is really hard for me. So the idea of being able to take some of this stuff with us, because I can't take the actual experiences in the room I was in with me, maybe I can at least take some of the more tangible things. So that's probably the reason it's still in the freezer, and probably the reason it will stay there.
Yeah. Those are some of the things like that you wouldn't have to do to ingest it. But then if you did decide you wanted to ingest it, like there's a whole range of things there. Like we talked about, like going from kind of raw preparations. And I didn't mention, but you can also have it made into a tincture, which will make it last a very long time. And some people even then use the placenta later in life for menopause, and have that kind of placenta medicine for those hormonal shifts that one experiences with menopause. So a tincture is a really great option if that's something you're interested in, is like having it last basically a lifetime. But even if you do the encapsulation, like if you keep them in the freezer, you can use them for quite some time after baby's been born.
Which is what I've done. Mine are actually still in the freezer, and I still take them from time to time, actually. And so 2 years, we're probably maybe coming up on the expiration date. That's what Anna would say from like a professional perspective, but me doing what I want will probably continue to take them for as long as I want to. So.
Yeah, some people find them really helpful for especially like PMS or symptoms associated with menstruation, but even also just like major life transitions. Some people find them helpful. That I've talked to, that, yeah, like if you're gonna move or someone dies in your family or something like that they can just help ease the emotional transition.
And I thought of another question because this came up one time. My sister and I was like, well, do you want to take some of my placenta pills? And she's like, I don't think you're supposed to take other people's placenta pills. And I was like, I think you're right about that. But is there like, do you have a perspective on that, Anna?
I wouldn't say there's any official guidelines. And it's kind of like, I would think of it like breastfeeding. Like, would you breastfeed someone else's infant?
Yes.
Would you donate your milk, right, to someone else? Like there are properties that are specifically aligned for you individually, right? But it doesn't mean that they wouldn't be of benefit to someone else.
Yeah, especially when you broke it down into, like, these are the minerals you're getting when you're ingesting this substance. And so those minerals could really be, beneficial to anyone and provide potentially that energetic boost and those types of things. So
yeah,
that makes sense.
But I think it's kind of like this idea of like, we feel personally, it's an organ that we created. So like, do you want to share it? And who would you want to share it with? Right. Like
right.
feeling that relationship with it.
Right. Exactly. I think that'd probably be more for that other person as well. Like, do you want to take that? Like, do you want your baby to drink my breast milk? There probably are people who are like, no, that's a personal thing. So I think that'd be that person's
definitely
opinion too.
Or you might want to ask some questions too, right? Like, just like if you were going to use donated milk, like with the placenta, you might want to know, like, did you ever have a placental infection, or did you smoke during your pregnancy? Those are two of the biggest contraindications for ingesting the placenta later. But also, like, another reason to not do it is, let's say you have mastitis or overproduction of milk. You don't want to be taking placenta pills because they're known to boost milk production, right? So just thinking about some of those things too.
Yeah, that makes sense. Do you have any final questions or anything, Samantha, as we wrap up here?
No, that was so fascinating.
And Anna, do you have anything else you want to add before we close up?
No, I don't think so, but thanks for having me on the show. And it's been so great to talk to you guys about all the things placenta.
Yes. And now if you have clients who are like wondering about placenta, you can be like, hey, check out this podcast. I can tell you all about it.
That's right. That's right.
Yeah. And before or after this, we'll get all your contact information if anybody's interested in encapsulating or wants to learn more about what you do. We can send them your way. But yeah, thank you so much for being here.
Yeah, thanks for having me.
As always, thank you so much for listening to the Becoming Mama podcast. If you could give us a 5-star rating on Spotify and Apple Podcasts, that really helps us out. You can also leave us a review on Apple Podcasts. And if you're watching us on YouTube, be sure to like, comment, subscribe, all of those things. And to connect with Emmy and myself and to connect with Anna, all of our information will be down in the description, social medias, websites, all of that. We will see you back here next week. Thank you for being here.